research methodologies groups, if the moderators wouldn't mind to introduce yourself and what your topics cover.
I was part of one of the research methodology groups. I don't know if it was the first one or the second one. But hello, everyone. My name is Catherine Quissel. We had a very interesting discussion about some of the data challenges right now, and we started to get into a little bit of brainstorming, but didn't have quite enough time to address everybody's concerns. But basically, there seem to be similar themes. People concerned about typical data sources that have had more significant lags, that a lot of data, it takes 12 to 18 months to get access to. And so the need during the current circumstances for getting real-time data to be able to analyze and turn it around more quickly, and how to overcome and maybe think creatively about new types of data sources given people's areas of research. There's also, we had a lot of discussion about people who are finding that their typical respondents are suffering from pretty significant survey fatigue also under these particular circumstances. So thinking of other more creative ways of getting information, potentially using photo voice or less traditional methodologies that are just new and different and may put less of a burden on people that you keep coming back to for information over and over again. And then we also had a discussion on what to do related to data quality. Again, if we're moving to new sources of data that we don't typically use, or trying to turn things around more quickly, how to do that in as transparent and ethical and thoughtful a way as possible. So those are the main topics of conversation in our group.
Thank you very much, Catherine. I'm guessing there will be some points as we go into the later groups that you'll see are reflected, and we can see the synergies creating. So the second methods group, was there anything additional on research methods your group might have talked about?
Hi, this is Yuan Lai from second methods group, and I will try my best to summarize our discussion. So we think in terms of method, there are kind of two parallel challenges. One is data collection methods, and the other one is research methods in terms of data analytics and data science. Some particular challenge during this COVID-19 pandemic is how data challenge can respond to different demands. And this demand varies by the geographical scope and the specific population groups. And then there are some research methods also facing challenges due to the unexpected policy shocks, cross variation, cross different geography, and also to this different variation created by the crisis. Finally, we kind of discussed some popular research methods or uncertainty involved in certain methods, such as synthetic control, or using synthetic data to understand either human mobility or use some sort of synthetic data for modeling and policy analysis. And that's overall our discussion.
Thank you. Thanks very much. The government partnerships, I'm looking to see what might be the thoughts that group came up with. So this would be the breakout group called Government Partnerships, if that rings a bell. If not, we can go on to the dissemination channels. Is there anyone from that group that might want to summarize?
Hi, this is Tom Akana. So that was a group that we were in. So we ended up discussing and bringing up a lot of the things that have been mentioned so far, particularly questions about dealing with data accuracy and availability in the current crisis, and really kind of what the impact that has had on research in general, as well as how that research is then getting fed into whether it's government policymakers, whether it's public venues, things like that. A lot of what we kind of narrowed in on was the idea that aside, separate from kind of traditional research, which tends to be very careful, tends to take its time a little bit, we're in a situation right now where that research needs to feed into policy discussions and decision makers who have to do things very quickly, because there is a lot of pressure, both public and private, in the current environment that this research is then trying to inform. So the question really becomes, how do you get your research completed, get appropriate levels of feedback and interaction within the academic and research environment about what you're doing, as well as communicate that information then accurately to the people who are using the results of the research in order to make decisions that affect, you know, huge populations of people.
I think you touched on something really important, which is, and maybe organizations like APPAM could be thinking of, how do we create these quick venues for feedback on research? And so thanks very much. The kind of related to this, the data set availability group, Christopher. You're on mute, I think.
Okay, how's that? Is this good? Is that good?
Yes.
Great. So we talked through the data challenges we're experiencing, ones we're hearing about, and talked through what's out there, what's available, what should be available, and shared a range of experiences and came to a couple of common perspectives, I think. One big challenge that we settled on was transparency and accessibility. A couple of researchers in our group recognized there are some signals out there that the federal government isn't preparing to share information about funding from the CARES Act, for example. And one of us had extensive experience working with American Recovery and Investment Act funding data. That the government made that data very transparent, a big database that of all the institutions that got funding, for example. And this type of transparency and architecture isn't even being discussed as a real possibility from what we understood. So this is really something that I think that we were interested in understanding how people would have access to in the future in order to understand the impact from the CARES Act. We discussed briefly the accuracy of fatality counts and the data that's available on deaths. Just recognizing this broader discussion about, for example, the numbers coming from senior homes, whether they could be overrepresenting counts there, or more broadly, some other considerations that suggest that we are undercounting deaths more broadly. And I think we were recognizing some standardization on this front would be very helpful, since this data point is going to feed so much other research. For example, understanding the definition, the distinction between direct and indirect deaths, maybe understanding which tests were tied, or sorry, which fatalities were tied to actual tests and which weren't. So we sensed a general data gap. We recognize the broader need for funding for collaborative data sharing and associated works. We've got a wave of impacts that are happening right now, and that those are all headed our way. We're going to need to understand them. So prioritizing funding for this research is big. And then we also recognize that it's interesting to see the collaboration that's springing up locally. We heard about an example in Indiana where researchers from the university system and the governor's office were working in very quick fashion, collaboratory efforts to get the state ready and into randomized testing quickly. So it's interesting to see what's happening organically.
Yeah, and I think this feeds right into the government partnerships. If we could have a quick recap of what was there. Thanks, Michael, for volunteering.
Yeah, so I'm going to talk about what we discussed on the government partnership. Sorry, I came in late, so when I joined the breakout session, so we're just trying to discuss how it's has been happening. We looked at how countries like Nigeria, where I operate from, was trying to cope with the pandemic. Of course, unexpectedly, they were not expecting that to happen. But a key issue that we also looked at is the success stories that was coming from the Asian countries in terms of contact tracing. the use of technology in contact tracing, came up clearly, and then the privacy issues that were associated with it, and how countries in Europe and of course the US could adapt to such contact tracing, and then considering those privacy issues. So that's one of the key issues that we found out that needs to be properly looked at as it affects public policy implementation. Then another thing that came up in our discussion was on the lapses of trying to provide from the government side protective equipment to industries, and then for workers that are critical during the pandemic, such as industry that needs to produce. So it was also an issue that was identified as the lapse as it concerns public policy. So these are some of the issues that came up during our discussion that may prompt further discussions.
Thank you very much. The next group that's on the list is data interoperability. And I also want to acknowledge we set up a very ambitious timeline, I think, when we were planning this, and we're 2:15 is when we are envisioning the second breakout. So I just want to ask Tara, is that a technical issue that we take a few more minutes, or is it that it's programmed at 2:15 to take us into second breakouts?
No, you can continue. No worries.
Okay, so we'll try maybe a quick minute from each of the groups that are remaining and stay somewhat on time, but still there's so much we want to be able to incorporate from those.
Yeah, we can certainly extend beyond the 3 if people are interested.
Okay, so we'll aim for perhaps another 5 or so minutes if we go. Data set interoperability is the next group.
Hi everyone, I'm Chris Curran. Was there some, Lyndon, you want to jump in? You were taking notes, so you probably have better records than I do.
Sure. We covered actually a lot of the same topics that have already been covered. We looked at primary data collection challenges, sources for observational data, and then the challenge of disrupted data. In brainstorming some solutions, somebody suggested using Google Survey for primary data collection, basically 15 cents per response, with some controls over the demographics to which one reaches out. Mechanical Turks as well as another solution. On the more expensive end, there's Qualtrics and Pure Spectrum. For observational data, the Census Pulse survey was mentioned for current data, though not micro level. For more micro level data, and of course these data are only useful insofar as they apply to your research question, SafeGraph data and home-based data were mentioned for data on compliance with various social distancing policies. And then finally, when we talked about the challenges of disrupted data, we brainstormed alternative solutions for missing data on child abuse, domestic violence, and possibly education and test scores.
Thank you. And I think these are all things we will try and think of as resources to share, because it's interesting to see some of these same themes coming out, and also to thinking, what can an organization like APPAM do again to be highlighting what the data gaps are. So the next is institutional challenges.
So I think that's me for our little group. And we had a very wide-ranging discussion about institutional challenges many ways. So one of the things that came out is that people are doing a lot of research. Institutional challenges are not. Lots of research is getting done. In fact, the Russell Sage Foundation is inundated with like 3 times as many applications as they've ever gotten before for a letter of intent, because there's so much interest in doing research in this area. That was very encouraging. Some challenges in sort of 2 other phases, not big challenges, but challenges. One around disseminating the results of research to policymakers who could act on it. And we heard about some interesting models for doing that, working with trade associations, working with journalists, working directly with the governor of New York to produce some analysis that is kind of the things that the governor wants and maybe not so much the researchers' interest, but this opportunity to open a line of communication that may pay off later. And then we had some discussion about the kinds of publications that people are doing, which is like a lot more working papers and preprints, scientific preprints, and getting things out very, very quickly. And we talked a little bit about whether that was going to be a challenge for junior faculty in the tenure process in institutions and so on. And actually, people were remarkably optimistic about that. So that was very good. That there are ways to get your information out, and that the rise of preprints may make the whole working paper world look different than it used to in the past.
Thanks very much. And I'm just thinking about how what we could do as a way to share all this information also is in the few minutes we have, if you were group moderators, please write down in the chat what your resource or points would be, and we can save the chat and collect all that somehow to put together what came out of all this. So, and thanks everybody for being so cooperative and share and realizing we've tried to squeeze a lot into a short time. So I have in the transdisciplinary partnerships, and then after that it's international partnerships, applications for future research, and then we're back to our second groups.
So I can jump in for the transdisciplinary groups. So we made more progress, I think, identifying challenges than solutions, which maybe was not surprising. So we were talking about things like that the usual organic process that might lead to interdisciplinary collaborations is that everything is moving so fast right now, and that the urgency, the sense of urgency time-wise is sort of like nothing we've ever had before, really. That there's really not that kind of time for this organic development, relationship building, putting together a giant long-range grant application, all the time that might take, and kind of how the natural tendency is to run into your own silo when that happens, because those are the people and you can crank work out quickly with, right? And that as a result, I mean, we all acknowledge the importance of various disciplines to this issue, right? So it's maybe not ideal, but that's kind of the way it tends to go. We're talking about ways to maybe build in shorter order, these interdisciplinary partnerships, and how maybe reaching out to people in other schools, like on your campus, and getting connected, just asking to be connected, is not a bad thing. Like, no one gets offended by that sort of thing, right? Even cold out of the blue emails, I don't think people, they might say no, but I don't think they usually get offended by this sort of thing. And then we talked about, some incentive issues we had a lot of junior people in our group, and that the really professional disincentives against interdisciplinary work, if you're in a disciplinary department in particular, with particular journals and so on that are expected, right, and some risks, and so some of really is a lot more about some of the barriers to these collaborations, while realizing that they're needed.
Yeah. And similarly, I think we'll have these same themes come up when we talk about international partnerships, which is next, if those themes were echoed. I wonder.
I'll jump in for international partnerships. So the first thing was we surveyed everyone in our breakout room and said how many people are doing international comparisons or international research right now with respect to COVID-19. And maybe about half of one person's effort might be going to international, and virtually overwhelmingly everyone was focused on US, even local issues. So probably the first natural thing to think about with international partnerships is, I'll bet a good chunk of the people who are on this entire web conference are all mostly focused on the 51 different jurisdictions and the various policy rollouts and the relative high quality data in the US compared to many other countries despite all its flaws. And so the things that are kind of lacking to do international partnerships, which I suppose means data, perhaps funding, and also for many of us, also understanding culture in other countries. Probably the most necessary condition is high quality data. As much as we might have complaints about the US, we suspect that there are probably issues in other countries that would make the US look like a relatively high quality data center. And then, as was echoed at the very beginning, in the US, we've had a haphazard implementation of trying to protect our population against COVID-19. Other countries might have a more top-down national strategy, which might make good sense policy-wise, but makes it much harder research-wise to try and learn about how things matter. That would lead you to cross-country comparisons. However, then you get into data quality issues across countries. And so those were a handful of challenges. And we didn't really come up with any solutions other than, I think it was a little bit unspoken, but as bad as things are in the US, we suspect that there are many other countries that are being hard hit, and the data or even just the nature of government is such that we're never really going to learn the scope of that anytime soon. So those are all real challenges, I suppose, with international collaboration or partnerships.
Thank you. This all now comes to applications and future of research. So look into that group to bring us home.
Sure, this is Kriti Jen, and I was part of one of the application research groups. So we were a group of primarily university-based researchers, including social epidemiologists, sociologists, public administrators, and a lot of economists, and all women. So I guess the randomization worked. So some of the points that we came up with were that, this context is changing very, very quickly. You can look at the news in the morning and look at the news in the evening, and the pandemic curves have changed. We thought this didn't impact children, and it does. And in the same way that the pandemic is changing so rapidly, so are the relevance of our research questions, our surveys, and context that we're using. The context in which participants in research exist is completely different. Someone who is in a different part of the country and therefore has a really different experience with the pandemic, or someone in a different socioeconomic level is also going to have a very different experience. That is another challenge with ongoing research. And then I think there's also this tension between, do you continue with your original non-COVID related research that you originally set out to do, or do you switch over to COVID related research? And I think, what we came to is that whatever your original scope of work was that you set out to do is going to be influenced by and altered by the pandemic, given that we will most likely end up in a very different world after this, because this is, as Dr. Jha said at the beginning, we're still in the beginning of this pandemic at the third inning. I don't know baseball, so like an early inning, I guess, out of whatever number of innings there are. And institutions and economies will have to change as a result of it.
Thank you. Thanks everybody for sharing all those insights from the breakouts, and I think we've got quite a sense of the agenda in front of